Bismillahirrahmanirrahim. Assalamu alaikum to all. My voice is clear, doctors?
Yeah. Voice is clear.
My voice is clear, doctors.
Yeah, it's clear.
So, regarding to this mock, yes, thank you, doctor. We'll start the first long test session and then communications discussion. And according to our voting panel, first long test session in my voting, I'm saying that is the doctor name is Umme Joino. Dr. Umme Joino is here.
Yes, doctor, I'm here.
Okay. So, Dr. Umme 5 minutes for prepare yourself, then 15-minute discussion and the structure you have to follow. Then examiner question crossing will be started and the score will discuss how is your skill according to your performance. So we are starting our session. Dr. Ummejano, is that okay? The file
Yeah,
and the
okay.
scenario is clear?
Yeah, I can.
Dr. Ummejano, let's start.
Hi, I'm Dr. Janab, one of the doctor in this medical admission unit today. So you are Mrs. Jackson Laurie, 35 years old.
Yes, doctor, I am.
Okay, I'm here today to discuss regarding your health condition as well as examine you. Is that all right?
Yes, doctor, it's fine for me.
Okay, and during our conversation, I will take some note which will be fully confidential. Is that okay?
Yes, doctor.
Okay, so Mrs. Jackson Laurie, how can I call you?
It's better you can call me Mrs. Laurie.
Laurie. Okay, so Laurie is fine. Okay, all right. So I have informed that you have been suffering from problem in your urine, auto work. Would you please tell me in your own?
Yes, doctor. Initially I didn't bother on that because I thought it may happen. But nowadays, around like 1 week, I feel it's a change in the amount and color, and it is really not a real picture of my aorta work. So that I'm very afraid. Is that any emergency? And if I need to search your advice, that's why I'm here for discussion.
Mhm. Yeah, I'm sorry to hear you. I will try my best to sort out your problem and help you in this regard. Okay. So would you please tell me that regarding the amount of your water work, is it reduced?
Yes, doctor. Yeah, initially I didn't bother as I said, but for the 3 weeks, I noticed that the amount is decreasing.
For how long? I couldn't get you.
2 to 3 weeks.
2 to 3 weeks. Okay. And what about the color?
Doctor, actually, this is frothy.
It's frothy. Okay. And for the same duration, you're noticing this?
No, doctor, it's around, that's why I'm here for discussion. It's around 1 week that it's increasing the frothiness.
1 week, increasing the frothiness. Okay. And anything others that you are bothering?
Yes, doctor, for last 2 days, I noticed there is some red stain light. I am very afraid. I'm seeing is it blood or something else? From where this red discoloration of my water work?
Blood. Okay. And is it fresh red or dark?
It's a dark, doctor.
Mm-hmm. And all this thing, do you have any previous episode like this, or it is first time?
It's first time, doctor.
Mm-hmm. Okay, all right. So, is it all the time when you are passing urine, you are noticing this type of thing?
Yes, last 3 days I'm noticing this type of changes of the color. I mean, the sometimes reddish dark. Sometimes I'm
Mm-hmm.
seeing it's more frothy, and sometimes think I have no water work, and that's why I'm so much afraid, doctor.
Mm-hmm. Okay. And regarding your color blood stain in the water work, is it a whole stream? or initiation, during the initiation or after?
You can say it's just same like in my water work. It is not initial or at the end. It is just mixed up with my water work.
Mixed up with your water work.
क्या
Okay. Okay. And do you have any
TGS
tummy
में ही
pain?
मंगवाना है जाहिर है लेकिन
Kindly mute, doctors. Kindly mute. Thank you. Yes,
Do you have any
Dr.
tummy
Jonas.
pain?
No, doctor.
Mm-hmm. And any pain during passing your water work?
No, doctor.
Mm-hmm. And what about your water intake?
Yeah, fine. And my friends said that I need to take more water, and I'm doing so, but I didn't notice any improvement. That's why I'm very much afraid of.
I see. And do you have noticed any raised body temperature?
No, doctor.
Any night sweat?
No, doctor.
Any lump bump in your body?
No, doctor.
Any recent weight change?
No, doctor.
Okay. And are you getting paler than before?
I didn't notice, doctor.
And what about your bowel habit? Is there any change?
No, doctor.
Okay, all right. So do you have any past medical history that I need to be aware of?
No, doctor. I don't have.
No. And any surgery or any procedure?
No, doctor.
Any history of blood transfusion?
No, doctor.
Any medication you are taking regularly?
Yes, doctor. Like now, just around 1 month, I'm feeling some pain of my hand joint and my wrist joint and the foot. I mean the fingers. So I'm taking NSAIDs. It's around 2 to 3 months. But nowadays I'm taking more because I feel good. You know, doctor. I'm a dancer, and it is my habit. So I don't want to get some this kind of the discomfort during my dance. So I'm using this kind of the painkiller to relieve this symptom.
Okay. And any over-the-counter medication besides the painkiller?
No, doctor.
Okay. And any family history of similar condition?
Yes, doctor. My mother has multiple sclerosis, and as she's suffering from weakness, but I don't have. But I feel tired. That's it. And my brother has some heart racing something. I don't know the diagnosis actually, but my brother has some difficulty of breathing, some heart racing.
Okay. Okay, I see. I'm sorry for them. And Mrs. Lori, regarding your joint pain, since when you are suffering from the joint pain, and do you seek any medical advice for that?
No, doctor. I am facing this giant for last 6 months.
Last 6 months. And which joint are painful? Would you please show me? Okay,
These are the
I
my
can see
hand joint.
hand joint. Okay.
Yes.
And is there any skin rash in any other part of your body?
I don't have skin rash, but I noticed and my friend said when I on expose of the sun, I'm flashing like this and she taken a photo and it is that. It is not
And
open.
have you noticed any hair fall?
Yeah, recently for last 2 months I noticed that my hair is falling down.
Any soreness in your mouth?
No, doctor.
Any soreness in your private part?
No, doctor, but mouth sore intermittently I face that it may be some vitamin deficiency. So I was taken and it's resolving. So it may be intermittent on and off. But I don't have
And
now.
any skin tightening? Have you noticed?
No, doctor.
Any weakness during standing from sitting condition or combing hair?
Yes, I feel when I try to comb my hair and I try to brush my teeth, I feel some weakness to raise my hand.
Yeah. Okay. And do you notice any finger color change on cold exposure?
I don't know actually, but I noticed one time as there was some cold and there's some snow in the
Mhm.
outside and this discoloration of my foot fingers, but it doesn't always. So I
Okay.
covered always by
Regarding
shoe.
regarding the pain, have you noticed any morning jamming?
I didn't notice actually.
Okay. And anything make your pain worse? Any activity or taking rest? Hello?
Your your voice breaking, Dr. Joyner. Your side. You can tell ask me again.
Actually, I can't hear you sometimes. Your voice is breaking. I don't know which side the problem. Okay. I'm going to examine you. Is that all right?
Doctor.
Okay. At the hand, I would like to see the joint.
So that I just want to break it. Just give me 1 second. Dr. Joyner, you can start.
Okay. So I would like to see your hand at first. Which joint are painful? I'm going to just check the temperature and feel your joint. If you feel any pain, please let me know. I would like to
Yes.
check the joint. Have you noticed any swelling over there anytime?
No, doctor, you see that there's some redness, and this redness occasionally it appears, it comes and goes this way. I don't feel so that it is any importance on that. But
Mm-hmm.
sometimes my fingers joint are painful, but there's no
Mm-hmm.
swelling.
Is there any? I'm going to feel your joint. Is there any pain now?
No, doctor, there's no pain now
Okay.
because I had already taken
Would
the
you please,
painkiller.
would you please do the make the prayer sign and reverse prayer sign?
So reverse prayer sign is a difficulty to do so,
Okay.
but prayer sign is
Mm-hmm.
okay.
I would like to check the pulses of the patient.
Pulse is normal and regular. It's
Um,
at outside 78 beat per
okay.
minute.
And I would like to ask the patient to pinch her skin. Is there any skin tightening?
No, doctor.
Okay. I would like to check the proximal myopathy.
Proximal myopathy positive.
Okay. And I would also check the observation chart at this point. Is this same?
Uh, you're offering the observation chart and the blood pressure right now 140/90.
On 40/90. Okay, all right. And I'm going to check her eyes. Have you ever feel any red eye or any gritty sensation and dryness in the eye?
Sometimes, yes, doctor, you're right. Sometimes I feel there's some redness, but no
Mhm.
grittiness, and it smoothly it resolves
Okay.
itself.
Okay, I'm going to pull your lower eyelid. Please look up for me. I would like to check the anemia and jaundice as well in the eye.
Anemia is positive.
Mhm. And I would like to check the hair fall and skin rash and on the face butterfly rash there is and I
Now
would
there's
also
no butterfly rash. Yes. Anything else? There is a yes hair loss, but it's not. It's 2 minutes left. Yes, there is a hair loss present.
and in the oral cavity is there any soreness
It's
present or not?
normal.
Okay. Do you feel do you have any short of breath?
Oh, occasionally when as I'm dancer, I feel some difficulty of breathing nowadays.
And any awareness of your heart?
Yes, occasionally, doctor.
Okay. So I would like to check your lungs as well.
What you want to see?
Is there any added sound, any crepitation?
No,
Fine.
clear.
Okay. And in the precordium, I would like to palpate.
It
Is
is
there any
normal.
chill? And
No, no
is there
chill,
any aortic region, any murmur?
no murmur.
Okay. I would like to complete my examination by checking the pedal edema.
There's no pedal edema, doctor.
Okay. And okay. So what's your concern, Mrs. Lowry?
Doctor, I'm afraid of that distressing of the heart due to the any heart problem or why my urine is decreasing. Is it any failure of my kidney, doctor? What do you think?
Yes, since I talked to you and examined you, your redness of the urine and the decreased amount is most probably due to a disease condition called mixed connective tissue disorder. Don't bother with the term. It is due to defective defensive system who is supposed to attack the your skin joint and many of the organ, including your kidney and lungs as well. So that's why you have been suffering from this type of problem.
So
It's
why my
mostly
heart
a
is
heart
racing?
problem. Yeah, sometimes due to low blood count, your heart can be racing.
Okay, time is up. So 1 minute for the recap. So doctor, can you tell me what are the positive findings in your case?
Yeah, Mrs. Lori, 35 years old, female, came with the history of reduced water work and also red color and frothy urine for um, 2 weeks. And on further query, he has a history of hand pain and also joint pain, and there's the Raynaud's phenomenon was positive, and there are some rashes over the hand as well as on the face on sun exposure. And she has also give history of taking NSAID. So based on and on the examination, I could found that there is a sign of Raynaud's and also Godfrey papule, and proximal myopathy was positive, and patient is anemic. And so based on above, I have some differential in my mind. It could be lupus nephritis on the background of mixed connective tissue disease.
Is there any differential, doctor, you have?
Eva?
Any differential diagnosis you have in your list, doctor?
Yeah, it could be vasculitis as well.
Okay. Anything else? Okay, doctor.
No.
Can you tell me how you will investigate your case?
Yeah, at first I would like to do the routine blood workout, complete blood counting, including with inflammatory marker and renal function test, including the routine urine examination, and the same creatinine and same urea electrolyte, and I would like to do the renal biopsy as well, and autoimmune screening like autoantibody, including the ANA, anti-DSA DNA, anti-Smith antibody, and also anti-Jo-1 antibody, and anti-MI antibody, and as well as anti-RNP antibody.
So how
And
you'll manage your case, doctor?
management including admitting the patient right now and treat the acute kidney insult, and forming the multidisciplinary team, including the rheumatologist, nephrologist, and physiotherapist and occupational health therapist and dermatologist, and starting the immunosuppressive agent.
So for the any specific drug you want to give in this case right now,
Yeah,
according to your diagnosis?
mhm. I could start the AC inhibitor now for renal insult, and I would like to start the DMRD as well, along with steroid.
Okay, time is up. Thank you, doctor. Yes, time is up. Well done, Dr. Jainab. Yes, it is a little bit complicated case and there's lots of concern And this, I mean, there is some question scenario was asking medical management, judgment, all was important. So first of all, the marking, clinical communication, overall, no history of pill pure pregnancy, 3P, no, this was missed, right? It's a female patient have miscarriage before, patient taking OCP, any kind of the clot, and it was family history, but the patient itself, is there any clot history or not? So 3P missed for the communication. Another for the, it is a glomerular streptococcal nephritis or IgA nephropathy. Is the previous an infection or recent infection? This question was also missed. So examiner wise always vary marking. Some examiner will give unsatisfactory only for the pill period pregnancy simple question, or some examiner will give the borderline. For myself, I will give borderline mean 1+1, because all overall question was asked, but pill period pregnancy along with the any kids, whatever the last age of the kids, the question fully missed. No support of the social health support, job support, patient is dancer, and impact on the dancing, how she's managing. Along with that, patients is smoker or alcohol, no question, right, Dr. Joyno? So this social and this support was already missed. Physical examination, very nice, no examination was missed, so it is a 4. Clinical judgment. Clinical judgment, as it is a misconnected tissue disease, so that here all question wise the investigation, specifically biopsy, not offered by the patient, that we have to do the biopsy for the staging, which stage of your renal function right now. Should we start the, should we do the admission? It depends according to the biopsy, but now we have to take care on that about the decision according to the multidisciplinary team. So regarding the clinical judgment, few mistakes you did, but first of all, you did admission, but according to the admission, there's a multidisciplinary team, yes. But along with that, the biopsy report will be appropriate to start the management plan. And you didn't tell the main question of the exam. It is a steroid. DMARS obviously will start. We are admitting our patient. We'll start the treatment, but one question specifically examiner asks by which medication you want to give right now to suppress this inflammation, steroid. So clinical judgment overall, if one examiner give the satisfactory and another will be give this, just there is a borderline this way. Concern, at last to concern, it is United States, yes, low blood count actually the cause for the racing heartbeat, and it is not any cardiac issue. And regarding the driving, no question was asked, though there is no vision problem, but need to advise if anytime you feel, because there is a complication may appear. No driving question was asked. Concern overall, it was missed. It was made by Dr. Jarno. So overall, it was getting by 3. So if we count here, so around what will be the score? Around 22. Good. Score good. Right, Dr. Jarno, any question your side?
No, doctor, I missed many things. Most importantly, 3P and social history. I couldn't
So
manage the time
differential,
actually.
Dr. Jarno was missed. Yes. Yes. Okay. Differential, it's a real exam feedback. Differential was again NSAID induced interstitial yes, vasculitis. Dr. Joanov said it was third, or if you say, but NSAID was recently patient taking more NSAID. That was the point. So NSAID induced nephritis, it was another differential. So patient said, yes, I have started lots of water drinking, but it's still not resolving. So it means it is aggravating factor right now. Alcohol, smoking, 3P question, very important. And mixed connective tissue disease, regarding the stop NSAID right now, this advice is very vital. I always say Mark is in your hand. Whatever is your performance, you'll carry all mark. It is in your hand, and the examiner must they will give you. So that the performance, the skill development only check where I am missing, what the point I'm missing. The Dr. Jano didn't say that stop NSAID, so it's vital. If patient continue NSAID, though we are admitting, we don't know the biopsy result, so it depends according to the result. Dr. Jano already said the family history and the examination did nicely. All examination was covered in this point. So if anyone have any question regarding this case, we can discuss. Then we will start the communication. In my communication list, the candidates voting was Dr. Sumbul, if she is not here, Dr. Abdul Hamid, Dr. Iman Shaheen. So today was voting. Now, who is active? Yes, Dr. Nora asking if suspecting infection. So say Dr. Jarnum said, yes, we have to do the CBC to check the infection. Obviously, if infective marker is higher, we have to start the antibiotic. But it is a case of the SLE or this is the lupus nephritis. So actually, main question examiner asks by which medication you want to get. This is the judgment and this is the mark here. So steroid must. So my panel of the voting from the communication, if Iman Shaheen is not here, Dr. Raid Khan, Dr. Simon, yes, Dr. Hero Alom. I mean, it's a Hero Alamin, right? You want to practice communication, right? You can unmute yourself and you can start with me.
Okay, ma'am.
So, Dr. Hero Alamin, your next station is communication. Let's start. 5 minutes in your hand for prepare yourself. Next, we will start the discussion. Let's start. So, Dr. Hero, start.
Okay. Hello, I am Dr. Alamin, or the doctor of today's clinic. Are you Mr. Stewart, 27 years of age?
I'm Mr. Stewart and my age is 27.
Okay. So, Mr. Stewart, today we are here to talk with you about your health condition and what we'll do further in this regard. Is it okay?
Yes, doctor, it's fine for me.
Okay. So, before starting our discussion, can you tell me how much you know about your condition?
Yes, doctor, you know, I have some lungs problem. It is called asthma. Yes, I was admitted before yesterday, actually, but it is not new because I was admitted 2 occasions previously. And right now I'm very good and I'm waiting for the discharge, doctor. When will you give me discharge, doctor?
Okay, I appreciate your feeling, and I'm sorry about your condition, and happy that your condition is improved now. But Mr. Stewart, I am sorry to tell you one thing is that due to due to some communication barrier, we give you the medicine that is known as bisoprolol and aspirin uh, in your case, in your discharge.
Bisoprolol, aspirin, mistake. What you are telling? It is not my medication. Which medication? Whose medication you are giving? Why are you giving? I feel dizzy from the morning. Why? Why are you giving this medication, doctor? This is not my medication.
Mr. Stewart, I am so sorry, and I apologize on behalf of whole team for this mistake. It is not actually, it is not, it is completely unintentional. Due to same name, actually we give you this medicine instead of other person.
Instead of other person mean you wrongly give me this medication. Which type of medication? So you want to kill
Yes,
me, doctor? Oh my God, how bad hospital it is.
I am so sorry, Mr. Stewart. So, Mr. Stewart, can I tell you what steps we can take after we identify our mistake?
No, 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 doctor. Tell me if you already given me this medication, then what will happen to me? Will me I me
Okay,
die? Oh my God, doctor,
okay.
when I'll die?
I appreciate your feeling. I know you are so much worried about this condition. But Mr. Stewart, what we do when we identify this problem that you feel TG, we immediately stop this medicine, this pressure medicine, high pressure medicine that is bisoprolol,
High
and
pressure
also
medication. Oh my God, I don't have any high pressure.
yes, we know that. So I tell you that due to some communication error, we give you this medicine, and when we identify, we stop this medicine, and we also, as you feel DG, we also make a team to look after your condition and assess your condition. Are with me?
No, no, doctor, I'm not understanding. When you will give me discharge, give me the discharge. I don't want to stay in this bad hospital. All team are the bad. I want to do complaint. Tell me where I will complain.
Okay, I appreciate your feeling, Mr. Stewart. Yes, you have a right to complain against any person. So if you want to complain, I can help you in this regard. I will help you by there is a team which is known as Patient Advisory Liaison Service. Here you can complain, and it will not further interrupt your any management further. But I want to tell you that as your health is our first priority, as it is completely unintentional, so we will try to do our best to solve this type of problem. So we also make some few steps to prevent this type of things further. If you want, can I tell you?
What are the steps you have taken? Already you did mistakes. And this mistakes is very harmful for my health. So tell me
Yes,
what you
I
are doing.
Yes, I am so sorry. So, I've already told. What we do, first of all, we stop those all the medicine that we wrongly gave you. First of all, second of thing, this that we will make a note, which is known as incident report. Why this happened? We also involve our senior colleagues regarding this issue, and we also make a team, which is known as medically root cause analysis team. What they will do, they will try to identify why this happened, what is the wrong, and how can we prevent it further. And we also discuss all those things in our monthly meeting to prevent this type of things in further. Are with me?
Yes, doctor, I'm with you. But is there any surety that it will not happen in future for other patients?
I appreciate your feeling. So actually, in our hospital, we are well managed. We are so dedicated that this type of things is not usually happen in our hospital. So as it is mistake, we will try to do our best to prevent this type of mistake in further by doing all these reports. Are with
But
me?
doctor, I'm feeling dizzy. When it will stop and when I can go to my home? Tell me.
Okay. Yes, I appreciate your feeling. So as you are feel DG, so our team will assess your condition and give you medicine if needed. And when your condition will be stable, we will discharge you. Is it okay?
No, doctor, I have to go home because I have emergency work in my office. Give me
Okay. So can
discharge.
can you tell me why you want to go home?
Because I'm a driver. My baby, my wife, and everyone is still they are suffering. So I need to go home and I have to start my job.
Okay, Mr. Stewart, I'm so sorry that your all family are waiting for you. But one thing is that your health is first priority, because If your health is deteriorated further, it will also hamper your further any activity, your job, and also your whole the family can be suffered. So I can tell you that it is better to now stay in the hospital for your proper improvement. After that, you can discharge to your home. Is it okay?
Okay, doctor. 2 minutes left.
Okay. I want to tell you something. Do you smoke, Mr. Stewart?
Yes, I do.
Okay, so as you have bronchial asthma and it is you are hospitalized recent. So any amount of smoking is injurious to health. Even it can aggravate your smoking. So it is better to avoid smoking. If you want, I can send you to a smoking cessation clinic. They will help you in this regard. Is it okay?
I'll think about that, doctor. Because without smoking, how I'll like. So okay, I'll think
Okay.
about that.
Okay, so another thing I want to tell you that as your asthma is recently not well controlled, do you have any idea why it is not controlled?
Actually, yes, you said that I'm smoker. That's a fact, maybe. And I have some pets in my home, newly I arranged from the Atlantica. So it may be another cause. I know, but I love my pets very well.
Okay, I appreciate your feeling, but one thing I want to tell you, Mr. Stewart, that as you have pets, and this may be one of the factor to aggravate your asthma, if possible, you try to avoid these pets to improve your asthma. Because I am
Oh,
afraid to say that sometimes this asthma can be causes your life in danger. Are you with me?
doctor, can I use face mask?
I appreciate your feeling. You can use face mask. It will also protect your condition, but if possible, better to avoid pets and dogs. In this regard, I also talk with my consultant regarding give you your further information in this case. Is it okay?
Okay, doctor.
Do you have any well practice in inhaler? Have you take the inhaler regularly with good technique?
Yes, doctor. I am taking her very frequently, but last 2 time I need admission. I understand that and it's newly arrived my
Hello,
pairs from the Atlantica. It may be the cause.
hello.
So my your question is that yes, I need to admit 2 times due to newly arrived these pairs. I understand, but yes, I will take care about that.
Okay, and ma'am, if there is and another thing, Mr. Stewart, that if there is any time you have not a good technique of inhaler, we can involve the district nurse. They will guide you regarding the good technique of inhaler. What about in this regard?
Okay, I'll think about that because always district nurses are taking care. But newly arrived pests may be the aggravating factor for the last 2 occasions I need to admit there. Thank you, Dr. Alamin. Your time
Okay.
is up.
Okay. Thank you. Thank you.
So there's no questioning in this dietary, so that we are starting judgment and the performance. The aluminum performance you did very well, but few sites need to more improvement. Yes, it is a very common scenario coming nowadays. So first of all, clinical communication, Dr. Alamin was very quiet, calm, but the sympathy voice, first of all, it is what? It's a medical error and it is a breaking bad news. Patient will be discharged now, but we are not discharging. This is the breaking bad news, and we have to be very polite and to say that we are sorry to tell you that we are not discharging you today. Then patient will be shout, but we need to say that yes, we mistakenly given this medication. Unfortunately, two patient name was the same. That was the cause. We understand how you are feeling now, but we are here for help you. Second, the communication score for few mistakes and till 10 minutes, no even one time Dr. Alamin asked me concern. Right, Dr. Alamin, you didn't ask me any concern. I have lots of concern. So concern didn't mention, right, Dr. Alamin? So that concern mark fully gone. That's the recent died too. Even my closest, nearest friends, only for 1 mark. Only for 1 mark was for the fail. So it is easy. Better to ask frequently. Do you have any concern? I understand your feeling. Be soft, be cool, be calm. That's the point to carry more mark in the exam, right? This is technique. So this is the concern is the one point that didn't ask ever. Because I have lots of concerns. I'm a driver, even no driving issue, no DVLA, Dr. Alamin, right? Judgment. Judgment gone. Judgment out of 1 or 0. Because there is a patient said, I'm a driver. I need to support my family. Where is the DVLA? Where is the stop the driving? Now there's a dizziness. We need to further work upon that, right, Dr. Alamin, right? So this was the missing judgment. Because communication, it is not like investigation management. It is that what you are doing right now for your dizzy patient, how you are managing your patient. You have to say that right now, I understand it is a very difficult time, but you have to stop the driving and you have to inform the DVLA. It's very vital to stabilize yourself, though we will stabilize you and we will give you discharge, but you have to inform. And you didn't ask what type of the vehicles he's driving, right? So this type of the communication, if I say in communication clinical skill, it will be around 2, borderline both 2, and there is a managing patient concern, there's no concern management, right? And there is adjustment. So very vital adjustment was missed. First of all, my doctors, whenever medical error scenario, it is not like patient is not adherent to the medication. Okay, do set up, do guide. Okay, are you adherent to the medication? Why the exacerbation has been? This is not my fact. Fact is that error. And where there is another way the scenario was round to the, there is a vehicles, means patient is driver, that's dizziness. So DVL is a most important point which completely missed. So judgment again 1 + 1, 2 or 3 this way. So around 5, right? And there's no constant meeting, right? So 0. So around 5 to 7 will be the in total mark, Dr. Alamin, right? You get the point.
Yes.
So
Yes.
these are the issue that finally we said, okay, fine. Today one of my friend from the Abu Dhabi said my station 4 was very excellent, but the mark sheet said it's only 7 due to the communication skill. It's a real fact of the exam. I did very nice, but examine showing that it's failed due to the practice. So this is the heartbreaking that when we see this type of the mark in our real exam, because you are talking and examiner are judging what you are telling and all are marking. Even the 2 examiner, they are judging what you did say. Every word, every point is the marking. So I'll tell a little bit, I'm not tell in details because it's a very common breaking bad news than medical error scenario. Dr. Alamin said nicely, this is incident report, root cause analysis, very importantly covered all the topics. So introduce, would you like to anyone else that any expectation, what we did commonly? And there's a breaking bad news, like first of all, close eye contact. Obviously, even the examiner always see what you are doing, what is your attitude, what is your movement, all they are marking. And there's, I'm sorry to tell you that news that I have today is not a good, then silent, shut up this way. We have to go forward. Then doctors, again, there is no history taken, like any impact on the family. I myself said that my family, my wife, my baby, they're waiting. So implication of the job, implication of the family, we need to take in detail history, right? So all the points is very important, managing the further plan. Already Dr. Alamin said nicely, we already stopped the medication. Hopefully, whenever according to the duration, it will be resolved and your symptoms will be improved. But it is very important to monitor yourself to improving your condition. Any question from anyone? Thank you, Dr. Alamin and Dr. Jaino. Very well done, and hoping for the best for the future exam. Thank you. Assalamu alaikum.